Right off the bat, but it's all good.
Oh, you can put it on then. And we are live on Facebook now, so y'all have to behave.
Yeah, squeeze them.
All right.
Pull that cord out so you're not choking yourself. Way under here. And then put your mouth on the mic like this, horizontally. You can jerk the whole thing.
All right, here we go.
Just
Got
like
it.
that. So put your lips like right
on it.
Yeah, just like that. That's good. And so, and Jennifer allows crosstalk. So if one of the doctors has a question for each other, go ahead.
We just jump right in.
Jump right in. You can crosstalk like that.
So when do we?
Jennifer will start it, and then she'll introduce you, and then, hi, I'm Dr. Courtney. I have a practice. You know, this is. All right, and I plug in.
All right.
Okay, we're back on. There we go. Make sure your phones are on mute.
Okay.
And,
Should our phones be on mute?
Yeah. And
That's mute, you said?
That's pretty quick then.
okay, we are live.
How does my hair look?
All right. Nice and long, Jennifer.
Thank you. Well,
We're about a minute and a half out. Minute and a half
mess
out.
up my hair do.
And Dr. Lewis, if you want to lean in a little bit so you can see that, remember that camera over there? Like this way, towards me a little bit, you know, so then the camera can see you. Basically, it's, you know, you guys are all parallel like that. Sure. But everybody can hear us on Facebook right now.
Okay.
Hi.
It's up on Friday.
I'm going to slide the camera over a little bit because I can't see Dr. C so well.
Let me lead into it.
No, because then you'll cover the guys.
Okay.
I'm just going to move the camera. See that?
Okay. Yes. Oh, yeah, I like back more. I look skinnier. When they had it low, the Facebook Live low, I was like, I look like 20 pounds more. Look, that thing needs to be higher.
You got to shoot down.
Look at Mark.
There you go, up high.
There. Now we can.
We're about 30 seconds out, everybody. 30 seconds out.
Okay.
Oh, there we go. Hi, Lori. Hi, Diana.
Here comes the music.
Okay. Check. Nobody dance. It's on video.
You would not want to see us dance, I'm pretty sure.
Welcome to the Jennifer Sheehan Show. I'm Jennifer Sheehan. To see all shows, go to thejennifersheehanshow.com. So today, listeners, I'm so excited. We are going to be talking about back pain, and I know so many people struggle with back pain, to include myself. But I want to introduce everyone. Dr. Stephen Courtney, spine surgeon. Thanks for being here.
Very good. Thank you, Jennifer. Hello, everyone.
Are you having a good day?
Yes.
So
Friday.
far, so good.
It is Friday. Yep.
Dr. Jerry Lewis, pain management.
Hello.
Dr. Russell Skinner, primary care physician.
Good afternoon.
My bratty co-host, Carmine Ledestri.
Hey, you know, I liked it better last week. There was a whole bunch of women here. Now it's just a bunch of guys.
You know what? I'm outnumbered, but I'm okay with that.
I watched that program.
This is Jennifer's show.
You know what someone told me the other day? I think it was my new, Kevin is my new action coach, and I've hired him to help me do my business coach. And he said, Jennifer, you kind of fool everyone from the outside and the inside, because the outside you look very high maintenance, and the inside it's like, suck it up. You're kind of like a man inside. I'm like, what?
No kidding.
You think so too? Well, I am kind of no nonsense, no drama. So I think that's a good thing.
No BS.
That is not a bad thing.
So back pain is, to me, a very serious thing. I think starting back in my 20s, I started really suffering from back pain. And I think what did it for me was the United States Army. They were kind of hard on my body from having poor me carrying like a 50-pound, 60-pound rucksack, an M16 and an M60. I don't even know how much that weighs, like 60 pounds.
Like 7 pairs of shoes.
You know?
You gotta put it within shoes and purses for her now.
So, and then they made us run on concrete with combat boots and all kinds of stuff that I'm sure just did a number on my spine at such a young age. And then I was in supply and armor, so we had to like change tires that went up to my waist. I don't know how much those weigh either, but anyway, it was just really hard on my back. And so with that, I've had to do a lot of different things to help and maintain, and I do different things, both surgical and non-surgical, are out there. But I want to talk to Dr. Courtney first, being a spine surgeon. Yep. And has his own hospital, Eminent Medical Center.
Right.
Love your hospital. So what made you become a spine surgeon, Dr. Courtney?
I was getting medicine when I was a young child in Louisiana, then on the farm. But my mother, she had back problems from hauling hay and lifting hay and dealing on the farm. But she had an issue with her back, and it got me interested in medicine first, and then slowly transitioned to spine surgery in medical school. But I saw a strong woman go down from back pain, so I take it very personal, very personal in that regard. So I got involved in that way. Then I just evolved, and I went to orthopedic surgery, and then did a fellowship in spine surgery, and then I've been in practicing in Plano for about 23 years now, and my practice is exclusively just for necks and backs only. Yeah.
I love that. And then the beautiful hospital that you have now, Eminent.
Yeah.
What made you want to start a hospital?
You know, healthcare is a changing world, as we all know. You can't determine what your deductible is, your insurance is. So I just took it on myself to make my own hospital. I've already had my own spine implant company, which is a little bit unusual for most spine surgeons. But when I was at LSU, I did a lot of biomechanic training over there, and I learned the sort of the business of how to make implants. And what I do on a daily basis or a weekly basis is, when I operate, I put in implants most of the time, sometimes not. But it evolved from making my spine implant company about 8 years ago. And then I saw throughout the country how it's starting to become a very, very broad corporate medicine structure. And I just chose not to go down that pathway. Spine surgery should me to be a very personal experience from the person and to the surgeon.
Right.
Because if you operate on someone's back, you really need to you have to know the person and be very aware of what they're doing and what actually happens in their daily life. So I've made the hospital to make an environment where you can still practice as a physician, not as a corporate doctor. Because in North Dallas and Collin County, medicine is very huge. But I've been very happy with the hospital environment, and also the patients love it. I've been up about a year and a half, and I've been very fortunate.
And
I love it.
I can testify to that. I've been lucky enough to do about 30 testimonials for Dr. Courtney, and he just picks patients out that have different stories, and they come into me, and they're not prodded. I mean, I take their story down, and they're very real on camera, and it just the amount of lives that not only that you've saved but changed.
Right.
The stories I hear, I'm always blown away and get the chills down my back, and the amount of love that's being thrown your way through your patients, the personal relationship you have with them, always just testifies on the difference between a physician and some large corporation that's just putting doctors through the
Yeah, and that's throughout the United States. So that's why I decided to make the hospital, because I can control it. The patients love it.
The cappuccino machine and the chef.
I love that cappuccino machine.
I love that cappuccino machine.
It should put out
too.
Starbucks, and it would. But it's a great coffee machine. But it's real important for the patient to understand, what their problem is. My back hurts. I hear it all the time. But to get the diagnosis correct is very vital too in treating patients. So you really need to get be aware of what what their problem is, and I go through a very detailed patient education with them. To let them understand, like, this is what your back pain is. Right. Not everything needs surgery, like Dr. Lewis, a pain guy. There's a lot of interventional pain medication, too. So it's very important to get the diagnosis correct first.
Right. So tell us about your keychain. Remember when I first saw your keychain? So I've done Dr. Courtney's marketing for a while now and got to do the grand opening of Eminent Medical Center. It was so much fun. Yeah. So when I first saw that keychain, because we go out to all the doctors' offices and I get to introduce them to some of them, and I said, you know what, that's really pretty. It could be like a necklace. He says, no, Jennifer.
No, it's not a necklace. You can't have it.
And why the colors? Why Purple and gold.
So when people, because I'm finna go to Baton Rouge in about 4 hours from now, but everything I make and design is usually purple, green, and gold for LSU. We design the pedicle screws, the cages, the cervical plate. And when a patient comes to your office, if you're going to have an operation, when I put this keychain in their hand, they say, "Wait a minute," I said, "This is what's going to go in your body." And it gives them a very real visual. This is going in your body, and so I put it in their hand. They can see it.
Right.
They can touch it, feel it. Then they get a better appreciation of what to expect, because back surgery is a very scary procedure for most patients. But if you give them all the information and you give them the keychain, which has a tremendous amount of product on there, the cervical cages, cervical plates, pedicle screws, very minimal low MIS screws. So when they always say, "Dr. Courtney, do you do MIS?" I said, "Yes," but when I show them the keychain with this massive screw, I said, "Oh my gosh." So it gives a real good visual aid to see what's going on in their body. I think they deserve it.
Absolutely. And knowledge is power, right? Because we're really afraid of the unknown. I know discs don't get better, right? I mean,
they don't. And unfortunately, the problem with the disc is, you can have real strong muscles and strong bone. That's why I work out quite often. But the disc is always a weak link in the chain. And, and very healthy people have disc problems too, but the disc, as you do get older, they start to get cracks in it and dry up and become a little more painful. So they become painful, and then things start to cascade down that pathway. You start having back pain, leg pain. But when my back hurts, it's usually from the joints in their back. But it's very important for the patient to understand and visualize where the back pain is coming from.
So question is, how do you know at the point? So I've been able to do all kinds of non-surgical things. Like one thing is planks. I do planks every single day.
Did you guys have a planking contest?
We did. Didn't I win, Dr. Courtney?
I think Courtney whooped her butt.
Yeah, I went over 2 minutes.
The guy is fit, I tell you what.
So we did all your artwork too, but I think I won that contest, Jennifer. It was close.
I think
Dr.
you did.
Lewis may give him a run for his money, though. Look at him.
Yeah, he would win.
No, sorry.
That's right. I'm not going to jump into that competition at all.
I forgot about that. You're funny.
It's important to be fit. Dr. Lewis, he works out a lot as well as I do too, different formats. But the problem with the disc is it's just unfortunately a bad tissue that wears out as we get older. Your hair dries out. Not saying yours, Jennifer.
Oh, thank goodness, because I like my hair.
Wait a minute.
But Carmen, maybe yours. But it just wears out, and it's a problem in the United States of America.
Right. Absolutely.
One thing I want Steve maybe to go into is, like, a lot of the patients that come to see us or come to see him, they want to know, well, what kind of defines when I need surgery.
Yes,
and that's kind of what you were getting
asking.
at. It's like,
yes.
What kind of symptoms am I having that make me, a surgical candidate versus a non-surgical candidate? And then you mentioned all these devices on his key ring. When would I, get certain things, as far as like a cage, or when would I, get a plate, or, what are some of the different devices out there? How's that determined? And then you might describe a little bit more. You said MIS, minimally invasive surgery. Right. So I get asked that a lot. So maybe this would help some of my patients if you kind of just go down a little bit of a
chronology.
Sure.
Yeah.
So what I do, I give them a package, and when they walk out my office, they have a very large package of papers. So at least they've heard it at least once. So we call it the circle of pain, because when they say their back hurts, you might not be able to see it, but it's a process of how you work a patient up. You give them time, medication, the diagnosis. You need to get an MRI scan or a CT scan. Then modify your activity. You got to be cautious. And unfortunately, it doesn't take much to hurt your back. It's been over tying your shoes or just something very minor.
Right.
Therapy, staying in shape is a big into that.
And it can be neck pain as well. True. Neck or back.
Right.
Then refer him to a physician like Jerry over there, and he does the injections, and he has this whole variety of different type of injections as well. But once they get that look, that's when they say, when are you going to operate, Dr. Courtney? So when you get that look, I said, what look? I said, you don't have it yet. but once you get that look, you'll know what that look is.
So you'll know when I'm ready by the look I give you?
You can almost smell them as they come through the door, because they have a different, it's a very serious, like, what am I going to do here?
That pain shows in their faces.
Yeah, and it's a vital look, and you can just look at a person almost, and, if you put everything together, the MRI scans, their patterns of pain. So a lot of people have pain, but they don't really know where it's coming from, but the patterns of pain is very vital. So if you just have like a sciatica doing on your leg, then you typically would probably just do like a microdiscectomy. But if you had like a previous back fusions and previous surgery before, then start doing more aggressive operations because unfortunately some people need that type of procedure.
What I love is like some of the testimonials I did. You just don't say, hey, let's say a surgery to everybody. I mean, you start out with the most minimally invasive thing. You start out with injections and pain management, and you scale it up as they need to. You don't just jump into it. You really have the patient's health, and not just the dollars and cents like a lot of other surgeons go. You need surgery like that. You really care about them, and you scale it up as they need it.
Yeah, I've been here for 23 years, almost 25 now, and I'm treating now patients of the people I've treated 20 years ago. Their kids and so forth. So they just come in there. They know my demeanor, and it makes my practice a lot more pleasurable than just running through the mill. So the majority of the patients I know, I have a very close tie with them, because they should as a patient to a spine surgeon, I would if I were them. But
Right.
I'd like to know also what my problem is and what my options are. So sometimes injections are very beneficial. Sometimes surgery sooner than later, but sometimes surgery maybe longer than later. It just depending what they have.
We see your son, Brent Courtney, listening. No pressure.
Hey, Brent.
So tell us hi, Brent. What does Brent do?
He helps with the hospital as well and certain things of that. And also he has his own company that deals with selling implants and hardware and bones. So he has his own business.
I love that.
As
I'm
well.
glad Brent's listening to us.
Yeah.
So when do I know? So I've done planks, I've done decompression, and actually decompression has worked the best for me personally.
Sure.
But if I don't do it every month, my back really starts hurting. So decompression, planks, I do get adjusted by the chiropractor at
Tell her to
least
stop
once a
wearing
month.
10-inch heels.
So I was just going to ask that. Do these 4-inch
Flats.
shoes, do they make it worse?
Yes, I change my shoe. I wear a different shoe every other day because
Really?
they just hurt your feet. Shoes are vital. Just like when runners run, runners are like little jackhammers going through your back. So a lot of runners don't have back pain, but I see a lot of people running. They have back pain. I see a tremendous amount of high school kids doing squats and deadlifts.
Right.
I can almost predict when spring football season starts in Collin County because they just come in the clinic in truckloads
Wow.
because they hurt their back because all they know is to do is squats.
Wow.
And it really hurts their back a lot.
You even make your own socks, don't you?
Yeah, yes, I do.
I have a pair.
I have a sock.
I do too.
I have socks and shirts.
I
and a few
fight
other
the kids
things, too.
over them.
So, but cycling is a little bit easier, on your body. You can get cardio as well, and also it makes your quads and your hamstrings and your glute muscles quite strong. So I'm a big fan of cycling and light weights. But even doing light weights, I'm 54 now. 4 or 5 years ago, I blew up my biceps just by lifting 25 pounds, and I'm sure
Wow.
Jerry wouldn't have that problem over here. To the right.
2,500 pounds.
It didn't me. But it just doesn't take much to hurt your back or hurt your ligaments in your body, especially as you get older. But
Just blow dry your hair and your neck goes out, right?
Yeah,
When I clean the house, I hurt my back, so I don't do it anymore.
So sad. Do you know that I had to stop
Very
cleaning? No cleaning, no yard work, no planting. Do you know what happens after I plant plants? I can't stand up straight for like 4 or 5 days. Literally cannot stand up straight. So I'm like, honey, I can't clean anymore. Sorry.
we see a lot
Can't
of those
do
on the weekends.
lawn.
In comes the maid.
And then we call them also the vacation victims, and the people that go out there, they go
Right,
go
skiing.
snowing and skiing and these things.
Slipping
and,
by the pool.
yeah, stuff like that. And some people, you got to be in shape to go out there and try to have a fun time. It's
Right.
important to keep your body in shape.
When I first met Dr. Courtney years ago, him and his wife were joking around, but not really, doing yard work. And I'm like, do I look like the type that does yard work? I'm not talking a little. His backyard's like a park, and he has an actual tractor, and he's laying down sod and stuff. So no yard work for me. My back, I can't handle the yard work. Good excuse, huh?
And I see a lot of people doing that, and usually on Tuesday morning clinic from the weekend. I see a lot of patients on Tuesday because of that same type of issue.
Weekend warriors.
Yep.
Interesting. I'm not complaining. I don't want to do housework or yard work.
We got a hard break coming up.
I'm good. So we're going to go to commercial, and we will be right back talking about back pain. Okay, we're still on. We're just not on live radio.
good.
So don't say anything you'll regret.
Greg Quinn said hi, Jennifer.
Hi, Greg.
And Diana, of course, and Brent, and
Oh, there's
Karen White, and Lori Coe. McCleaver.
Okay.
I don't know. Some new listeners. Some new listeners. Hi, everybody. If you have any questions, don't hesitate to Facebook them in, and the doctor can field them. The doctors, I should say, can field them, straight from here. So if you have any questions, go for it.
Absolutely. So let's go back to yard work.
Yeah.
We're not live anymore.
Well, that's fine.
We're live on
I did a lot of
Facebook.
yard work.
We're
but,
live on Facebook and video.
Always.
Is yard work, it is hard on your back, right?
It's like
Unless you have a tractor.
Well, it's like a Rocky Balboa workout. It's a workout in and itself, but people don't think it is. But it really is. You're pushing lawnmowers, you're weed eating, and you're doing just stuff. And you're putting out sod. I think I put out almost about 500 pallets last year of sod. But there's a technique to doing that too. But you don't want to hurt your back.
Right.
It doesn't take much, but if you do it on a routine, regular basis, I think it keeps your body in shape, and you get to burn calories, you get to sweat out there, and it gets to, you don't eat so much. Eat food is not good either. Food's like the
So isn't
devil.
that a big deal, keeping the weight off for your back?
Yeah, food, weighting, they always talk to me about the core, so I usually say the core is usually the food that goes down your throat. But it's hard to get your abs strong, but if you focus on your quads, hamstrings, glute muscles, and shoulder straps and lats, that's quite a bit. That's a lot in itself.
Well, you know why I didn't beat you doing the plank contest and your wife was judging it? You know why I didn't win? Because I was in a darn 5-inch heels and a dress. I was turned the other way. Lori was
Excuses.
counting.
Yeah.
But if I would have
Excuses.
been in tennis shoes and sweats, I might have won.
Hey, we got like 40 minutes left, so clear the table.
Yeah. So
We'll go live.
No, I'm in heels again. It's not going to work.
Yeah.
What do you say, Lori? Lori's in the sound booth. Nodding
Lori,
her head, yes. And
We
she's
can
like,
hear you, Lori, talking to the microphone. Lori, who won the plank contest between me and
Get
Dr.
close
Courtney?
to
I
it.
did.
Come close.
I'm going to have to go with Dr. Courtney. I love you, Jennifer. I'm sorry, but Dr. Courtney took that one down.
Yeah,
Was it
you-
close? I think it was close. I don't remember. It was about a year ago.
Yeah, it's been a while.
It's been a while, but I remember he won.
Okay,
So,
well, I've been practicing, so we'll see.
We'll set up a rematch.
Yes, we'll have a rematch.
Yeah, we do. We also at our house we have the Courtney Push-Up Challenge contest. Usually it's on December the 29th was my birthday. So I've been turning 55 this year. So my goal will be to do 55 push-ups straight up.
Okay.
So I usually beat all the boys and the girls. Catherine, my daughter, she can do about 35.
Really?
So push-ups are very hard too. But they're difficult.
Yeah.
So that's always a fun
Do you put
little
a piece of
activity.
cake down on the floor when you're doing that?
Yeah, cake is fine.
There's 4 more bites. Come on.
Yeah, you go right to
Push-ups
the
are
eyes.
very hard.
Yeah.
When you're in the military, when you go to basic training, you have to do 18 men's push-ups.
Right.
And
Yeah.
if you have not done them, it's almost impossible for a woman. And
It
so
is.
my dad, before we joined the Army, about a year before, he started having us do push-ups every morning. By the time I left for basic, I could do 50 men's push-ups.
Wow.
Now, I can't do them now. I still do push-ups, but I do girls' push-ups on the knees. But in the Army, they're like, they don't care if you're a girl or boy. You do the push-up the way you do it.
No, Dr.
So,
Courtney, we have a listener asking a question, which I think we already answered. It said, why did you choose spine surgery as your specialty? You said it was near and dear to your heart because your mom had back issues. Was that the
Yeah,
reason?
that's when I first started thinking about it. And we grew up on a farm and we did our labor ourselves. But I saw a very strong woman. You wouldn't really term a guy until you beat my mother in arm wrestling, and she's very strong.
Really?
Yeah, and
I
this guy-
love it.
And then, so they had to come over to our house and do arm wrestling before you were actually indoctrinated to be like a guy. So, but I saw her take her down, and that was my initial just inclination. Well, that doesn't make much sense. So just
Right.
curious, and then just gotten more involved in medicine, and sort of drifted that way. So that's how I got involved in it.
Right. I love it. And we all have our thing, right? That we do well.
Yeah.
And there's a place for all of us.
Yeah, and then when I was at LSU, I got to had a very fortunate time to meet Dr. Ed Benzel, who's a previous Neurosurgeon Society president and also a biomechanical expert, and I had a chance to visit with him or follow him around for a summer, and that's where I learned all the biomechanics of the implants. And so I've been doing biomechanics, messing with pedicle screws for over about 30 years now, over 30 years.
Which
now.
is amazing. You
Yeah.
saw the need and you filled it.
Yeah, and then
I remember you telling me when you did surgery, right, that you're like, okay, I could do this faster, more efficient,
Yeah.
and better by using this versus
Yeah,
this.
and the big companies, they have their thing as well. But if you can make and design implants in a way that's effective and more efficient for the patient, your infection rate goes down. And
Right.
then you can deliver a better product for the
Love it.
patient. Yeah.
I love it. And I love your heart to actually just care about those patients. And I love that you're so conservative.
Yeah, it is. It's until they get that look.
Because there's plenty of people when you can still be conservative and plenty of people that still are going to need your help and need surgery.
Yeah, and like
10
SI
seconds,
joint
everybody.
pain. SI joint pains are very common. It sort of lives back there. I think we're on the radio again.
Not yet.
Not yet. Those are just commercials. It's
Yeah.
the feed in.
Okay.
Keep going.
But like SI joint, my back hurts. Well, for what? I don't know. It hurts because of maybe SI joint pain or facet pain, and they can come in there just as debilitating just for SI joint pain, and that you don't really operate on. But if you get the diagnosis right.
We are live back on the Jennifer Sheehan Show, talking to Dr. Stephen Courtney, who is a spine surgeon and also has Eminent Medical Center, beautiful hospital in Richardson, kind of on the border of Plano and Richardson.
Yes, it's still in Collin County.
What is the address on that building? It's on the back of the magazine somewhere, isn't it?
Yeah,
oh, there it is.
It's on there.
It's
Yeah.
right by George Bush and Independence. It's on top of the hill.
Right. It's a beautiful facility.
Well, I
Well,
tell you,
let's go
Scott
ahead
and
and-
White. Actually, me and Jerry, we trained together a long time ago at Scott and White. They made a small hospital called Scott and White. It was on top of a hill as well. So it used to be Scott and White Brindley Foundation. The Brindley brothers were orthopedic surgeons. Really influenced how I treat people to this day.
Interesting. What's your website?
EminentSpine.com.
And what's the other one?
AdvancedSpineCenters.com.
Perfect. So, and Dr. Jerry Lewis. So interesting enough, I didn't even know they knew each other or had gone to residency together. And so now they're both my clients for marketing, and Dr. Skinner for that matter. Dr. Skinner's been my client in the magazine, in the Best in Collin County magazine now for 3 years.
3 years.
So a long time that you've been stuck with me.
Not stuck at all.
Thank you. So, Dr. Lewis, on back pain. So, how do people know when to go to you? So, the great thing about having all three of you here is that we all are going to a primary care doctor. If we have back pain, we're normally going to have to go through some of the non-surgical stuff. And then I wanted this show on back pain mostly because I've suffered from this my whole life, and just learning how to do non-surgical and then figuring out when the time is to do surgical and how you all work together.
Right.
So when you get patients coming in, which I'm sure a lot of your patients are coming from primary care doctors like Dr. Skinner, correct?
Mm-hmm. Correct. Yeah, it's kind of a continuum of care, and you have Dr. Skinner, who's primary care. He has chiropractors in his office.
Right.
You know, you have pain management and me sitting here, and then, of course, you have Dr. Courtney, who's a spine surgeon. And so it's really somebody comes in with, let's say, neck or back pain. Maybe it's only neck or back pain. So let's say they go see Dr. Skinner as their primary care doctor because they're seeing him for, other issues, other health issues. And so it might be something, and more often than not, that's kind of insidious. In other words, they didn't have a precipitating event. They just say, now my neck started hurting, or now my back started hurting, or there could be a precipitous event. And so depending on the severity of their symptoms, and I don't want to steal his thunder, but maybe, maybe he puts them on a muscle relaxant or, gives them an NSAID or something like that. If the pain persists, or maybe now the pain patterns change and now they have back pain and it's going down their leg, and, they're having buttocks and, calf pain. And so, he's probably going to image that patient, or, maybe they came to see Dr. Courtney first, and, they're going to do that imaging, or maybe they came to see me first, in which case, So then, as Dr. Courtney mentioned, you're going to get imaging studies, whether that's, X-rays, MRIs, CTs, depending on, what's indicated. And if that indicates, let's say, a disc herniation where you're putting pressure on a nerve root, and they have ongoing pain that's not relieved by, maybe they're doing some lumbar decompression with one of the chiropractors there, and they've already been on the NSAIDs, and but they're not having any ongoing muscle weakness or muscle atrophy. And another symptom that they could have that would necessitate a surgical emergency would be bowel or bladder symptoms, so it's called cauda equina. So if they're not having anything that,
so that's how you know it's emergency and you need surgery.
Exactly. And or if you're having ongoing weakness and you're having some atrophy, you don't want to mess around with that, because some of those...
Don't they leak? I heard someone say sometimes the discs will rupture or leak or something like that.
But this would be more of a disc putting pressure on the nerve root. And so you don't want to mess around with that for a prolonged period of time, because you can have some permanent damage in terms of weakness or in terms of sensory deprivation. So so those would be ones where there's a little bit more urgent to get it to the surgeon. The other instance where, let's say you image them and it would be a little bit more urgent getting that to the surgeon, would be somebody who has some sort of instability. In other words, they have a forward slippage of one segment on another, that if they were in an accident or fell or something like that, could cause damage to the spinal cord or other nerves. And again, I don't want to speak for Dr. Courtney, but those are some things that would be a more urgent thing. That's not something that, that they would continue to do, primary or chiropractic care or pain management on. Right. Now, barring those conditions and where it's more pain or it's interrupting their function, then, if they don't respond to some of the more conservative care, then that's usually when they're referred to me, either by, a friend, a relative, primary care, chiropractic, other spine surgeons, other orthopedic surgeons. That's how I get most of my patients.
Right.
And so depending on what the condition is, most of the time they're coming in mostly for interventions such as injections, whether that's, SI injections, facet injections, epidural steroid injections, selective nerve root blocks, or maybe the surgeon has a couple different levels that he's concerned about decompressing, and so he might send them for selective nerve root blocks at different levels at different times to determine, where the pain's emanating from, or if it's from both levels, or he might send them for what's called a discogram, depending on, what's going on with that patient, because imaging in and of itself doesn't always tell the story. Sometimes you have to do functional tests to determine whether or not that's the location.
Interesting, because we can't always tell where the pain's coming from. Like when you have pain down your leg. Interesting enough, I don't go to regular massage therapists because they give me fluffy massage that does nothing for my back. So I go in this little Asian place and they don't speak English. Right up the street in Frisco. When I go in there, the guy was like all on my butt, and I'm like, "What are you doing?"
Do they do nails?
Like,
and,
no,
Jennifer,
just
what did it say on the outside of the building?
Yeah, I was wondering that.
So he was like all like on my butt, my lower back, and I was like, "Dude, get
I'm
off
gonna be nice.
my."
I'm not gonna get that.
I'm like, "Get off my butt!" But when I walked in, I couldn't stand up straight. I couldn't stand up straight, and he looked like a big sumo wrestler. I'm like, "Oh dear."
Was that his name?
No.
Oh, that wasn't his name. Okay.
I was like, okay, why is he like on my butt? But they don't speak English, so I couldn't even really tell him. But when I walked in, I'm not standing up straight, and I'm pointing to my lower back. By the time he's done, I could stand up straight. I'm like, oh. So next time I'm like, have at it. I'm like, because something he did.
Was he walking on your back? Were there bars above the table? Okay.
But he was so strong, it kind of scared me. But
Right.
but it was so low into my glutes was where he was focusing on, and not even as much my lower back. But you know what? I walked out of there standing up straight, and I was like, okay, there's something to this with the muscles.
That's actually, you bring it up in a serious point. So let's say that's your first serious episode. It's not for you because you've been dealing with this. You may not want to get any type of significant adjustments or anything until you get studies, because like we mentioned, let's say you have a significant herniation or you have a significant mechanical, like I said, slippage that's going to be dangerous if you. So you want to make sure, if it's kind of one of your first worst episodes, that you get in and you get imaging before you do anything.
Right. You can screw it up worse.
Exactly.
So
So
if
whether
you're going for massage and he doesn't know that you were in an accident or
And
fell
that
down the stairs,
yeah.
and you can make it worse.
Exactly. So that would be with Dr. Skinner, myself,
Absolutely.
or Dr.
So I've
Courtney.
already had the
Right.
X-rays. I know I have 3 bulging discs, and I've been dealing with this since my 20s.
Right, that's what I'm saying. So if your symptoms haven't changed, then you know what you're dealing with. But if it's kind of a first worst kind of episode, then you want to make sure you get in and get that evaluated and get some studies done before you have, any kind of treatment.
Absolutely. And I know they
Particularly
get
when
worse.
there's been an inciting event, somebody's in a car accident or there's been a fall or something like that, where you can't even rule out fracture at that point based on history. So all that does need to be worked up prior to going in and having
The massage therapist could paralyze you if something's really bad,
Sure.
Not to his own, detriment, but he just doesn't know what's going on, because there's no imaging done, as you said.
So you just want to know what you're dealing with. So basically, short of a lot of the things we've already talked about. So what I would do when somebody comes in and it's not an urgent situation, it might warrant some steroid injections, like I mentioned, in some of those different areas. It might involve more of a workup if they're headed towards surgery, or it might be something where I can alleviate them enough to where they can get back in and they can get those adjustments like we talked about through Dr. Skinner's office. And so, there's a variety of things we can do, or if they want to go a little bit deeper, instead of utilizing steroids, there's platelet-rich plasma that's available to patients, and there's, stem cell available. And Dr. Courtney can probably attest to the fact that his fusion rate has probably gone up, utilizing some of those things, and Dr. Skinner's probably used those in his practice. So there's other things available. I mentioned those kind of secondarily because those are cash, even though they've been out there.
That's what I was going to ask, what covers insurance and what doesn't for our listeners to know.
So everything that we've mentioned would be covered under insurance, save the platelet-rich plasma or PRP or the stem cell type of therapy. Those are highly effective. It doesn't, and those products are FDA approved. It's just that insurance hasn't chosen to pay for those.
Get on that bandwagon yet. I have a general question for all three of you. Barring a car accident or some type of accident, how important is keeping your core fit? I mean, to your back, health. I mean, working out and stuff like that. Barring some degenerative, something passed on from mom and dad, or even that. Staying in shape very important for your back.
It's definitely important. I think all of us would say that. There's certain genetic, predisposition factors that you can't overcome, but you can overcome a lot, like you were saying, with your planks, and even if you have some degenerative changes, it's not too late.
I won the planks.
Are you sure? I don't remember. I have amnesia.
And part of it, you talk about remaining fit. It's twofold. It's not just remaining fit, but it's also maintaining a healthy weight, which usually we think of those things together, but there are people out there that are maybe overweight and, quote, healthy. In other words, they can ride a bike a long way, they can run, they go to the gym, they're still overweight. And if we have a lot of excess weight, that changes the biomechanical stresses on the spine, and so it can put the spine in a position that's going to make things deteriorate earlier, that's going to lead to more back pain, whereas if we're maintaining a healthy weight, which is part of fitness, can really help stave off some of those problems.
Just like Dr. Courtney was saying, I mean, you could just tie your shoe the wrong way, and throw out your back, because you're cantilever and you're just, heavier
we're
than you should
all over
be.
40, right? Are we all over 40?
Speaking to that, though, and kind of continuing, it's never too late to get started. Even if you've had back surgery, certainly it's better to, like I said, maintain that, prior to having any type of injury. But it's never too late to get started. And in fact, a lot of studies, I'm sure you have seen, will support going ahead and when you've had an injury or even when you've had surgery, and I'm sure Dr. Courtney instructs his patients on that, to get started strengthening that core.
Right.
Well, Jennifer, you can attest to that because you had another situation, not due to your back, but you had a esophagus situation, and then you couldn't have certain foods and whatnot, and you lost a bunch of weight.
25 pounds.
And
my back feels great now.
Right, exactly. Well, I mean, better than it was. I know you have
Does.
situations, but just losing that 25
I can
pounds.
totally tell the difference.
For every 5 pounds, she went up an inch on her shoes or something just to compensate. But,
so is it truly like really bad? Should I not wear these heels all the time?
You should not wear those heels all the time.
That's why I stopped.
Yeah, those shoes are bad, but like the guys
special occasions.
I stopped.
Special
occasions. I got it.
You did? You all stopped wearing your heels?
I rarely wear them.
Mine was just because of the hammer toe. But
that's good. Well, we just got done putting to bed the new magazine, and it's coming out, in a day or two?
Oh, yeah, so it's already out on the best in Collin County, magazine.com. So the digital magazine is already out. That actually everybody in the room is in the magazine.
Yeah. Well, the reason I bring it up is because we had to have the pose where her heel was up in the air and her red heels were showing. And when we shot it on green screen, when I digitized it out, they were like that. There was one,
and that shot wouldn't look good with flats on.
And when we digitized it and took out the background, it accidentally took out the red, and she about lost her mind.
I was like,
you took out the red. I didn't even notice.
I was like, look, these are called Louis Vuitton shoes. The whole reason women buy them is because they have red soles. Darn Carmine.
Dang you.
But you know what? I think I need to make some changes. I think I've made a lot of changes with my back over the years. Haven't gone to injections yet. Haven't had to do that yet. Been able to maintain it. Sometimes the pain does get a little bit worse. And I do take Motrin when it's really bad, but I don't take medicine any other time. So when I do take the Motrin, it actually works. So far I've been able to do it, but I am 47 and I'm getting older. So maybe one of the things I need to do is not wear the high heels all the time.
Correct.
Maybe it's just for, like Dr. Skinner said, special occasions. And when I'm shopping or in the mall or whatever, go ahead and wear flats.
Wear your flats. Right.
Oh, I hate that. I hate getting older. It sucks.
It's real important to get involved to a routine of working out. In my opinion, it's not really a routine; it's a way of living.
Absolutely.
You know, in my house, I mean, I have my gym because I built my own gym because for me, I got to stay in shape and stay focused on what I'm doing, and it's like everyone else would be helpful too. But it's vital to just do light weights and cardio, and just be more aware of what can trigger your back pain. It doesn't take a lot either, y'all. Not much at all. Yeah.
That's what I was going to ask you. Basically, all three of the questions for all three. We only got a minute, and we'll continue the question after their hard break. But what can people do? General, everyday, simple things to save their back. Just simple things are the biggest mistake people make.
Well, it doesn't take much to build your own gym in your house. I mean, it really does. You can make
I
a gym
have
here.
one
I
in the
have
garage.
one, but if I get up about 3:30 or 4 o'clock, I'm an early guy. I'm a morning person.
Oh,
so
dear. 3 o'clock in the morning?
Sorry, Laurie.
3:30 or 4.
Yeah, sorry, Lori. And Lori Courtney's on here watching, too, and
I just
in
get
the
up, and
room.
You just got to get up, and I give these handouts to my patients. Boxing is a great sport. What people
So working
Boxing?
out,
Oh, yeah,
anything
love it,
like
yeah.
that.
But even when you say get on the floor and stretch out, well, the floor hurts your back.
Right.
But if you have
Right.
professional boxing foam, you go to ringside boxing or title boxing and get this foam, like a 4x8 foot boxing foam. But my whole place it helps your back. It's not so hard on your back.
Yeah, so not everybody can
Okay.
buy, afford that. So if you got bubble wrap, save it out of the boxes. and put that on.
Bubble wrap on the
Bubble
floor.
wrap, yeah,
You're
so
funny,
we're coming
Carbine.
up on one more
So,
hard
yes,
break.
we're going to go out to commercial break, and we will be right back talking about pain in our backs. I was going to say pain in our butts, not like a pain in the butt.
Sometimes it is.
It does. Isn't that
is.
funny how that pain can actually go in different places where you think it's something else?
Yeah.
So
it
down your
radiates.
leg, like it's down your leg, and you're like, okay, why is my butt or my leg hurting?
Yeah, I give them that pattern of pain handout all the time so they can see, because they don't really know. But if you give them a handout like you have in your hand there, Jennifer, they can see
Look, I
what
can
pattern
show
of pain. It's very helpful for the patient, because there's different levels of pain in your back, 1 through 5 or 1 through S1. But each level will give you different patterns of pain down your leg, down to your back. And it's very vital to get the pattern of pain correctly diagnosed.
So interesting. I think this is all interesting. Well, mostly because I've got issues with it and had. And you know what? Back pain just sucks. It hurts, and it makes you not like, I'm a pretty happy person. But when my pain is like an 8, then it's very hard for me to do a lot of things. It makes me kind of grouchy.
Yeah, it does.
Well, and it's not uncommon to have, let's say, somebody that thinks they have hip pain, and it's really coming from their back, and vice versa. And it's not uncommon to have somebody to have shoulder pain and think it's coming from their shoulder, but it's actually coming from their neck, and vice
Really?
versa.
Very
And
common.
so
Very common.
that's why it's real important to get a correct diagnosis, because you'll definitely be going down the wrong path, and they may even be with the wrong specialist. So it's important to really, sort that out.
No, it is. You know what I love about everybody in the room is that I trust all of you. And I know a lot of doctors. I've got 200,000 emails, 30,000 on social media. I know a few people. They're not all good. And I don't mean like on my social media, but I mean in general, the people I've gotten in front of, they're not all good. And unfortunately, I've even seen it in the chiropractor world more than anything, where they tell me, I remember going to one chiropractor and he's like, you need to come for 2 years. He's in Dallas and I'm in Plano. You need to come for 2 years. You need to pay me like $5,000 up front. Oh, here, you could do care credit. and this is what you need, or you're going to die. Like, I
Right.
mean, like, it was so bad. And I was so upset. And I was actually crying because my pain was like at a 8 at that time. And just something in me was like, don't trust him, don't go. I went one time. I said, I'm not doing this. I'm just going to go ahead and pay you for the one time. And I moved on. But I just didn't trust what he was saying, because if he's already just telling me I need him once a week, I said, if I come to you, I think it was actually 3 or 4 times a week. If I come to you all the way from Plano to Dallas, I'm not going to have a business.
Right.
I got to work,
Sounds like an evil doctor. I don't know.
Exactly. And I won't say who he is because I hate gossip.
No,
but
we don't do that.
He is still around. So you have to just be careful. For me, if you're not at the top of your game, I'm not doing your marketing. You're not going in my magazine. You're not going to be a vendor or taking pictures or anything, because when I send a referral, it doesn't matter if it's the referring physicians who I've built relationships with for the last 15 years or people that I know. If I send someone to Dr. Courtney, I know he's going to take care of them. If I send someone to Dr. Lewis, I send someone to my bratty co-host for
Right.
for photography, which is still important, not as important, I think, when it comes to your health.
Hey,
but
Beverly
or Dr.
calls me
Skinner.
Dr. Love. Does that count?
No, it does not
doesn't.
count.
That's good.
But with
It's
Dr.
honorary,
Skinner,
though, right?
but I mean, if you're the plastic surgeon that puts the belly button back in the wrong place, I'm not doing
Yeah.
your marketing. You're
Right.
not going in my magazine. I feel so strongly about it because then when I send a referral, whether it be a doctor or a friend, I have to know that person's going to take care of business. They're going to care about the patient or the person, and they're not going to just be about the money. And unfortunately, there are a lot of people that are just about the money. So I love to not only get people together, but introduce them. Because what a great team do we have in this room. Really, this is a lot of talent in this room.
And the chiropractors, there's good and bad doctors,
Yep.
but the chiropractors, they sure have their role as well. I mean,
Absolutely.
they have their soft tissue treatments, and I believe in chiropractic
I do
treatment
too.
on certain patients and certain chiropractors. So I get asked the question all the time, what do you think about chiropractic? I think they have their role, just like I have my role, and
Yeah.
Skinner has his role, and Dr. Skinner has his role as well. So it's a multidisciplinary approach to treating back pain. But the more you understand where your problem is coming from, the more educated you are, and then you'll be able to sense a little bit better and get a grip on it and handle it a bit better and sense it better. Because most people don't know where the back pain comes from.
Right.
They just don't.
We're about 15 seconds out, folks. Go ahead and cue the music.
Yeah.
We're going to ask a question. Lori had a question about the sitting is the new smoking. But,
sitting is a
Smart
nightmare.
Lori
Yeah.
Courtney.
Yeah.
Yeah.
As soon as she gets back in, I think we're going to go to, and then we can cut in.
Welcome back to the Jennifer Sheehan Show. I'm Jennifer Sheehan, and we'll just get right back into it with Dr. Skinner, primary care doctor. And you know what I love about you, Dr. Skinner?
What's that?
Is that so
It's my
many
blue eyes, right?
Yes, that's it. So many MDs don't believe in chiropractors, and you do.
Correct.
I love that about you.
Yeah, we have an integrated practice. We utilize chiropractic care, physical medicine, massage therapy, as well as primary care.
So let me ask you, how many of your patients come in and say they have back pain? What % do you think?
I wouldn't even venture a guess as far as percentage, but it's probably our number one musculoskeletal complaint is back. And if you throw neck in and consider everything in the spine, it's probably our number one musculoskeletal complaint is back pain or neck pain.
Wow.
And of course, with our tech, we're seeing more and more neck pain. As
Right.
well.
Oh, no. So texting is going to hurt our necks?
Well, texting, laptops, I mean, everything.
The way we're
Everybody, and even
positioning.
just positioning, ergonomics in the office setting.
Your
all
phone in your
that
back
can
pocket.
matter. Well, your
Off
phone that you're
balancing.
looking down in your lap all
your
day.
neck down, yeah.
We call that the
And,
tech neck in
yeah,
our office.
Yeah,
Is that what we call it?
exactly.
Tech neck?
Tech neck,
tech
yeah.
neck.
Everybody
And,
gets that.
You see
Look
our
down,
kids
chin
walking
down.
around, and even the way they position stuff in the office, you have a computer and your monitor's down, so your head's in a down position, or you use a laptop, so you're always looking.
What if you got a
down.
pain in the neck co-host? How do you fix that? Wait, that's me.
Excision.
I agree
That's all
with
you
it.
can do on that.
Host, I meant the host.
You can excise. That's right.
So everybody's in Collin County, right? Where's your address, Doc?
I'm on
forgot
I'm
your
at Preston
address.
Plano Parkway.
Preston
That's
Plano.
easiest way.
And Dr.
to-
Lewis?
Oh, we forgot to ask Dr. Lewis,
Yeah,
what's your
what-
website?
Oh, it's just lewispayne.com.
How easy is that?
I know, I know,
I have it
tricky.
memorized now because I have to put all. We need Dr. Skinner,
Family Health and
MD.
Wellness of Plano.com.
I think we need Russell Skinner, MD.
Yeah, that'd probably be easier.
That would be easy,
Yeah,
right?
yeah,
I like
instead
that.
of Family Health and Wellness.
We'll talk about that later. So with back pain, when people come to you, what is one of the first things that you do?
History. I mean, obviously everything starts with history, and that does matter. We talked about it a little bit in the last break. If somebody's had an inciting event, they've had an accident, a fall, a car accident, then what we're looking at as far as differentials is different than somebody that comes in and says, I've had back pain for years, and maybe they had a remote injury that's no longer really pertinent, but they've had this ongoing kind of chronic low back pain. Then we also start assessing them as far as their fitness level. Is this someone that's overweight, that has degeneration? Is this someone that's elderly or not? And we begin to take that health history and see where is this coming from, how long has it been in place, and then the next step then is, all right, is this something that demands imaging right up front, meaning X-rays, MRIs, and so forth? They have any of these red flags? Dr. Lewis was talking about it. If they have muscle weakness, or they've got loss of reflexes, some of those sorts of things that we may want to image right away. Otherwise, we start usually pretty conservatively. Anti-inflammatories can go a long way to help relieve some of that pain. Muscle
Right.
relaxants, where we feel muscle spasm, may be a big portion of their pain. Chiropractic care, alignment, flexibility, whether or not their joints are moving correctly.
And what about
becomes part of
stretching?
it.
Like I started about 6 months ago. I don't eat right when I get out of bed. I have to stretch
Yeah,
because my back
flexibility
hurts.
is important. You know, if we think about any joint in the body, it has to be stable, number one. It also has to have normal range of motion, that is flexibility, and then there also has to be a certain amount of strength for that joint and those muscles to work. And so you have to look at all three of those things from a structural standpoint. Is it moving? Is it moving correctly? What's the stability of it? And is there strength there to, for that body part to do what it's supposed to do? And, of course, when we're talking about backs and necks, is to kind of maintain our normal erect posture. And so we'll go through that assessment of how they're moving, how their flexibility in each joint segment, you know, is it moving correctly? Sometimes we may recommend physical medicine or physical therapy, particularly if we need strengthening work or flexibility, stretching, soft tissue work, and then reevaluating. You were talking during the break about having some of these treatment plans that, you know, come see me 3 times a week for the next, you know, decade.
Right.
There needs to be reevaluation there. You know, that initial evaluation for us may be a week or 2 long, and then reassessing, all right, has this made a difference? If not, then we didn't image at the beginning. We may need to do imaging now. Sometimes nerve testing may be indicated where we look at nerve conduction velocities. If that hasn't shed any light, then referring to a specialist. And we usually are making that call usually within that 2 to 4 week mark. We're not seeing improvement with conservative measurement.
So how long should it be? Like, for instance, I got my MRI, it was at least a couple of years ago.
Mm-hmm.
So how long before? Is it if you're in more pain or?
It depends if there's been a change in pattern. If you had an MRI 2 years ago that showed, you know, I've got 3 herniated discs. What's your pain pattern been like the last 3 years? Same. Has
Right.
nothing.
Yeah,
Nothing's
there's
any
a
different.
question.
Nothing's changed. Do I need a new MRI?
Yeah, you know, like you're supposed to go to your GP or general practitioner once a year. Is there maintenance involved in what the three of you do? Should you be going to your doctor and getting a checkup, make sure everything's all lined up and all of that? I mean, do you start low on the totem pole and then go up? I mean, is there, or do you just wait until something happens and you catch it on the backside? Is there any maintenance involved in what the three of you do?
As far as imaging, which is what we were talking about, there's really no need for new imaging unless, as Dr.
Gonna
Skinner
change.
said, you've had a change in symptoms or a progression in symptoms, however you want to put that. So,
Right.
Well, it used to be a point where once a year, started about 5 years ago, once a year I could not physically stand up straight. I remember we did the shoot with Trisha Barnes with Riverbend Sandler Pools, and I physically could not stand up straight.
She was as tall as Trisha.
Trisha's 4 foot something,
4 foot
whatever.
something, right.
I was sitting down in the shot, and she's standing, and I was still
I had
taller.
to get her a walker.
So sad.
That's like
But,
when people come into your office, you know, my back locked up this weekend.
Yeah.
And I was locking up. It's usually from the facet joints.
Mm-hmm.
The joints are like the size of your knuckles, so they're not. Everybody's heard of a disc problem, but the facet joints is a very big structure that lives in the back. That's probably the most common cause of back pain is the facet joint. And
So-
unfortunately, it doesn't take much to get out of shape, and
No,
then
it
you
doesn't.
Right.
just sort of get sort of.
and when you were
aggravated.
talking about gardening and bending over,
Yeah.
Yes.
that's facet.
Yeah.
Okay.
Yep.
So I don't do it anymore. No gardening, no scrubbing the shower, none of that anymore.
Yeah, let's cure a couple of myths here like that. They always tell you, like when you're bending down, you know, use your legs,
knees.
keep your back
Legs.
straight, and go straight down. Use your legs and not cantilever. Don't bend over your entire body. Is that true or not true?
Well, that's true. Posture
That's
is
true.
good. Yeah. Huh?
When you're going up and
Yeah.
down to pick something up like that, so you don't accidentally throw something out of
Should.
whack.
And they've done some studies where they talk about, you know, using back braces and quote unquote correct lifting posture and this, that, and the other. And it doesn't have a big difference between the groups that just kind of lift the way they want and those that lift in that specific way. So it does also reflect a little bit of that there's a certain amount of biochemical or biomechanical design that you as an individual have compared to someone else. In other words, I can lift this way and it may not bother me.
Right.
Someone else can lift that way and it may bother them. We're all built somewhat differently. Our weight, our muscle structure, and so forth is a little bit different. And so when they did these in an occupational setting, did these studies, correct lifting did not necessarily decrease the number of back injuries, and wearing a
Interesting.
back brace didn't necessarily decrease the number of back injuries. Does that mean just bend over and pick up 100 pounds
Right,
any
yeah.
way you want?
Use your head.
No, you still need to have
Right.
some correct lifting
Yeah.
and engage in the muscles that are designed to do that heavy lifting.
Yeah.
If you look at a 3-year-old kid squat down and pick something up, how do they do it? They squat down, they pick it up, they stand up.
Oh, they do. I never even thought about that.
And that's natural. They've not learned how to do that. That's how they're designed.
We teach them the wrong way as parents.
Yeah, and we also, as we get older, we lose flexibility. Again, it's hard to squat down anymore. We may lose our
then you
leg
get down
strength.
there and you can't get back up.
Can't get back up. So you know what? So I bend over
And then you make
pick
that
it
noise
up.
getting up.
Yeah, so I bend over
Oi.
and pick something up, which is really not how it should be picking those, lifting and picking things.
And some people are just too strong, like the very classic example are the gymnasts. These guys are strong as bulls, but they're so strong they can activate those facet joints. I see a lot of gymnasts because there's so many gymnasts in this town, and also linemen of football linemen people. They're so strong, but they're so strong they aggravate their facet joints. So there's a definitely for the gymnasts, but there's a fine balance there for being a little bit too strong for your own good.
Balance. Right.
Interesting.
Yeah, and just as kind of a quick explanation, the facet joints are like the gears of the spine. That's what allows the spine to move the way it does in the cervical region or the thoracic or lumbar.
Show us, Dr. Courtney.
There you go. Show them.
Yeah.
Yeah, it's just
Show
purple.
the camera. Yeah.
It's just purple and gold. Go Tigers. But the facet joints are right here. And crawfish.
LSU.
And crawfish cures back pain. But the facet joints are here. So this is your lower part of your back. So that's what Jerry was talking about. When those joints get aggravated, it doesn't take a whole lot.
No, it doesn't.
And that's what
You have them
charge
at
up.
each level,
Yep.
so you have. I mean, you have a lot of joints in your back, basically.
Yeah, and Laurie was asking a question earlier about sitting is the new smoking. And having said that, my girlfriend about 3-4 weeks ago, who's got an amazing core and she's in amazing shape, her back went out. We couldn't figure out what was going on like that. It's because she was sitting too long at her
I know
desk.
some doctors that could help her.
Yeah, and she found out that if she got up and moved around every once in a while, then that sitting all day long in not a good chair that was screwing her up. And
that's sitting.
what's the smoking is the new.
And in this brochure I give all my patients, sitting increases the stress on your back by 30%.
Oh, wow.
So sitting is just a nightmare.
Yeah, your disc is under about 90 pounds per square inch when you're sitting, which is the worst thing you can do. And when you're sitting static, that's the highest pressure your disc can be under. So that's why.
So long drives, things like that.
Yeah.
Sitting at an office in a cubicle
which
for 9
is somewhat
hours.
counterintuitive for people because they would think, when I'm standing up, that's when I've got the most stress on my back.
Right.
Sit down, and I'm just going to relieve it, and it's actually the opposite.
So what about laying down when you're sleeping?
That's better.
Is it easier?
Less stress on your back when you're laying down.
It's good for your disc. It's not necessarily good for your facet if you're laying flat on your back.
Because I wake up and my back hurts when I wake up.
That's because
I'm like, have to get
those
up.
joints close up when you lay flat. And so somebody who has disc and facet changes, oftentimes they'll sleep in a recliner because that's kind of the best compromise at a 40. So if somebody comes in and says that they're sleeping in the recliner all the time, that's the only way they can get comfortable. You can bet they have both discogenic and facet disease.
Right. Or like, putting a pillow between your legs. So last night my back was hurting pretty bad. I put a pillow between my legs and it stopped the pain. I don't know why it stops the pain, but I do whatever I need to do to I love Dr. Courtney, but to avoid surgery if I can until that time comes when I have to see him. Even with injections, unfortunately, I'm allergic to a lot of things. I don't know if I'm allergic to injections,
Well, you're
but I'm
not
kind
allergic to your own body, so that's what's great about PRP or
so
stem cell.
PRP
Right.
and stem cell versus doing the
Right.
injection. So that's probably something that I would do just because I'm allergic to a lot of antibiotics and things.
Right.
So I haven't gone that route. I've just done, what is going to make it so that I can stand up straight? And it's been decompression, chiropractic once a month, taking that Motrin, really strong Motrin when I need it, which is normally once or twice a month. And now I'm going to stop wearing the high heels all the time.
It works.
Very good.
Whatever.
And then when it gets to the new point where, again, now it's been 2 years that I've been able to maintain this, and I've not had an episode where I can't stand up straight because that's not an option, So, yes, we'll go around and give everybody's website again.
Okay. AdvancedSpineCenters.com.
That's Dr. Courtney.
Jerry Lewis, LewisPayne.com.
And Family Health and Wellness at Plano.com.
And Carmine Ledestri, visual image photography.
And what do you do?
I'm
Besides giving me a hard time.
I'm a clicker.
You didn't mess with those buttons very much today. I was kind of
There's
surprised.
all the the fun little buttons over here on the side like that. And we just got a lot of brain power across the table here.
We have some
I didn't want to
smart
diminish
people in
that.
this room.
There's a lot of college money across the table here. That's good. So I didn't want to play too much.
But you know what? You really are amazing. And my favorite thing about you when it comes to photography and videography, so he did a video for us at the photo shoot for the cover
behind the scenes.
the
yeah.
behind the scenes. It's so cute. So he's learned to take us on the green shot and put animation in the back. So there's bubbles and fire
that's funny.
things,
Oh,
and
yeah.
so I put it on the website. But I just got the new magazine out, so it is on the bestincolincounty.magazine.com. So the new cover, and Carmine, of course, did a great job. He always does a great job. Even though the red on the bottom of my shoes isn't showing really well.
But those drone shots you have too are really neat. That we get the drone.
Yeah, I was
those are
lucky
really
enough
neat.
to work with
Yeah.
Dr. Courtney and his
was fun.
intro business shot. He's
Yep.
got great drone stuff too, which is you have to be licensed for that, ladies and gentlemen. You can't just get up and do that. FAA
was-
will get your butt.
Really
They
neat.
will.
That was the best video I've seen you do, was for Dr. Courtney's Eminent Medical Center, because it just got the full effect. Pictures couldn't really do it.
Well,
Yeah, it's,
The video.
I was wondering what she meant when she was talking about you droning on, and now I know it was actually a compliment.
Did you say that? No, he's your sidekick, right?
But what I love is that you are able to just position these people in the magazine and make them look so much better. That's why I use him, because he is one of the best that I've seen, you know?
Yeah, and he's done a good job. I've also, when he does my patient testimonials on CourtneyMD.com, a different one. But all the patients that went down there and gave positive testimonies, I mean, they really liked Carmine, and, you know, it made them very comfortable, and they did a good job getting their word out
Yeah,
to
the
them.
video was amazing.
was.
The pictures that he takes makes my ads look better. So if it's going to make my ad, like, look, he took that picture of you.
Yeah, he sure did.
And Dr.
Yes, it
Courtney's,
is.
Dr.
he's got
Courtney's
his
got the
own
next
cover
cover.
coming up
Woo!
like that. So.
That's right.
Dr.
Right.
Courtney's going to be a cover man. Watch out. I'm very excited. And you
Yeah.
know what? Besides me, you're the only one that's had your own cover.
Well, that's good
Are you
about
feeling
that. I'm feeling good
special?
about that.
Special.
Are we bringing in Sophia for this? He's so
feel like
handsome.
I
We don't
need
even
a
need
shirt.
hair
You
and
know
makeup
what?
on this.
I don't think he needs makeup. I think
Lori,
he looks
did you
good.
just nod your head up and down?
Yes, I did. Just maybe for the cover.
Okay, there we go. That's good.
All right,
Just
Sophia's
decrease the
coming.
shine a little bit.
No, it's
So, Jennifer, tell us your website again.
Oh, the JenniferSheehanShow.com, so you can see all of the current and past and ones for the future shows. And so thank you all for tuning in. We really appreciate it. And hopefully you got some really amazing tips with all this brain power in the room on back pain. So I thank you all for coming.
Thank you for having
Thank
us.
you.
If your back hurts, don't take a chance. Come and see one of these three
Right.
gentlemen.
That's right.
Absolutely. So I think anyone that has back pain, it's covered in this room.
Yeah.
Yeah, whether
Yeah.
it's minor or in between or requires surgical intervention.
I think this might be the dream team. Back pain dream team.
That's good.
Watch
If
out.
you've said, "Here, hold my beer," and then something happens,
Yeah.
then you see one of these
might
three
need to
guys.
see one of us.
Well,
You guys are so
fantastic.
funny.
Well,
Well, I
yeah.
love it that you guys also just start networking and send business to each other and support each other. And it's good for all of us, for patients, for everybody listening. And so thank you all so much. And we will
Thank
see you
you.
next week on the Jennifer Sheehan Show.
thank you.
Thank you.
Okay, we're going to take some
Here, we're gonna
pictures.
photos. Let me kill the camera.